Welcome to Catalent Gosselies 2020 virtual tour at Gosselies site in Belgium. My name is Marine and I am Senior Business Developer at Catalent Cell Therapy. With the current worldwide health state hindering our on-site prospect and client visits, our teams have been ingenious in reinventing this tour to make it virtual and bring it to you in a reinvented way. Now let's put on our face mask and head on to the next stop into doing our site tour. We are now on the 4th floor of the building in the Boulogne wing, where we will meet Adrienne, our supply chain manager, who will detail us reception of starting materials, raw materials and consumables, as well as the picking area, put into quarantine or release for the materials, and then the shipping area for all the logistics, supply chain management, and all the technical service associated. So let's go to him for the details and enjoy the ride.
Hello, I'm Adrienne. I'm the supply chain supervisor for Catalent, Gosselies, and I will show you the process for reception of consumable and raw material. At first, when the product arrives at Catalent, we will make the reception. We will register all the traceability information and control the conformity of the project. When the reception is done, we will transfer it in quarantine zone with the restricted access. It is transferred in the quarantine zone with a yellow label to have visual indicator to know which product we can use. And after control by our quality assurance, we will transfer it in unrestricted area. And you can see we have green label to indicate the released state of the product. The only way to transfer the product from storage area to production area, it's picking. The user will create the picking in our ERP, and after that the logistic will prepare the picking and transfer it in picking area. Once the picking is prepared, they transfer it in the picking area, and after that the user will pick the picking and transfer it in their zone. Concerning the storage capacity of Catalent Gosselies, we have capacity for 5 temperatures. Room temperature 2 to 8 degrees, -20, -80, and in nitrogen tank. For each temperature it's the same process. At first it's delivery, reception and registration of all traceability information, release and control by QA, and after that picking and transfer in manufacturing zone. You can follow me to the production area. It's downstairs. And we can go downstairs, and that's all for the logistic.
So as we are following the flow of the product, we have left the 4th floor with the reception of the starting materials, raw materials and consumables, and whatever is necessary for the manufacturing process. We have now reached the 3rd floor, on which are located our clean rooms for manufacturing and the PD labs, as well as the QC area. In the original wing, the Boulogne wing, there are 5 clean rooms, and on the Picard wing, which was transformed and inaugurated end of 2018, there are 4 supplementary clean rooms. All of them are quite identical, 30 square meters, approximately 300 square feet, and they contain the generic equipment, including incubators, the laminar airflow, pipettes, centrifuge, and all that is necessary to bring in-house your process. So follow me into the PD area, where we start with the non-GMP setting portion of your project. So now I will hand things over to Gauthier, who is a production supervisor at Catalent Cell Therapy, and he will go through the details of our PD labs, what we do in them in terms of activities, and how we organize for your project and the collaboration.
Hello, my name is Gauthier. I'm a production supervisor here at Catalent. I'm going to present one of our development labs. So here we are in the Picard wing. And when a new client arrives with a development process or with a tech transfer, this is here that we start. So those labs are equipped with general equipment like freezer, refrigerator, also laminar airflow, incubator. Here in the lab, We have also the opportunity to work with a bioreactor because there is a gas station connected. Also, we have welder and sealer for tubing connection and disconnection. GetherX, so we can work with the G-Rex technology. Here we have a Clinimax Prodigy for selection of cells or depletion. Here on the other side we have a microscope equipped with a camera, so we can follow up the cell culture and also take pictures. The computer is also linked to an automated cell counter. And here we have a scale and also electroporator, so we can engineer our cells with electroporation. Also we have water bath, and here it's a plasma therm, so it's basically a water bath. The only difference is that it's probably best for GMP because it doesn't require water in the GMP areas, and it's specially designed for thawing of bags, like leukapheresis bag for process start. Here is one of the other development lab where we work. So quickly, here we have the laminar airflow, the Xuri, so it's a bioreactor we use for cell expansion. Also, this development lab is equipped with an incubator, freezer, refrigerator for storage of raw material and cell expansion. If we continue, we also have Clinimax Lovo nucleocounter, so it's used for cell selection or depletion. This one is mainly for volume reduction and cell wash. So we have automated cell counter, so which is linked to the computer, and also linked to the computer. Here we use microscope with camera, so we can take pictures and follow the culture. If we continue, here we also have centrifuge and CPAX, so for cell wash, or if the process requires a specific step of starting material generation, like PBMC isolation with FICO, we can do manually, but we also have CPAX here to do it. And that's it.
Now that Gauthier has gone through the activities that occur in a non-GMP setting in the PD labs on the 3rd floor, we will move to the cleanroom area and the GMP setting, where we perform validation runs and aseptic simulation runs in a GMP condition. Although we may not be able to visit the cleanrooms for customer confidentiality reasons and because the projects are ongoing, and the fact that only authorized and trained personnel may enter, we will not be able to go there. However, we will be able to visit the quality control labs where we will go through the equipment and present to you how we do the in-process testing and release testing on the product. So follow me. As we are now gowned and we have entered the QC lab, you may see behind me all the equipment that allow to do microbiology testing and cell culture testing for the in-process controls and release testing that occur in the projects. Although some of the tests may be project-specific, some of them are generic, and we will perform them in-house in a timely manner to enable good follow-up of the project. So on the side, you can see a Cytoflex, in the back, a MaxCont, on the right, an Ella for qPCR, and in the very back, an NC200 for cell count and viability. All these equipment are used by our trained and authorized personnel within the project and for good performance of the release criteria and results obtention to make the project move forward. So we have now changed wings and are in the Boulogne one, where we have renovated some of the portions. We are now standing in front of an LCD screen which shows the Myriad program, on which we can follow temperature, humidity, and other criteria that needs to be controlled within the clean rooms and the GMP area, as well as any deviation and alarms should any of them occur. In the back, we will have the QC labs, so follow me. So this portion of the QC lab was redesigned to be able to manage thoroughly the QC in process control testing and the release testing. You can see here a second max count to the one we've already previously seen. You can also see in the back a ViCell for cell count and viability, and around it the generic equipment, so incubators, pipettes, centrifuge, and all the necessary elements to perform the test correctly. This is the biggest portion of the QC lab, both in surface and in number of equipment. Again, only authorized and trained personnel can enter from the quality control department to be able to use the equipments herein. As you can see, all the equipments, as in the other rooms, have green tags on them, showing that they have been released, QA approved, and mention the date for reapproval and renewal. So here on my left, you have a Spectramax, and in the back, you have an Osmotec equipment, and then an equipment for RT-PCR. On the rest of the QC lab, again, generic equipment for the usual bill of testing for your project that we do in-house. Here on my right is a pass box to decontaminate equipment. This is used to be able to segregate what has been used versus what is not used, what needs to be decontaminated from what is clean. Now over here we have a bacteria alert for the sterility testing, which we do also in-house for this method. And in this final room, we have numerous incubators which are used for the cell culture portions that are necessary in the projects. The incubators are at controlled temperature, humidity, and other criteria, and are regularly checked and QA released as usual. We hope you have enjoyed it and learned more about our GMP and non-GMP sections, the equipment on site, and all the activities that surround the project and collaboration. We do hope that this situation will improve and look forward to welcoming you on site to meet our teams and see the facilities for yourselves. Thank you and goodbye.